it must be so meaningful to you to go through this personally and now also be involved in the research and getting this message out there to more people. So tell us specifically about the research you're conducting. What have you done and what have you shown so far?
So we're really fortunate to have supported a pilot study of a ketogenic diet for bipolar disorder. And again, for many years, it was impossible to find people interested in this research or wanting to support it. But the Baszucki family, their son, Matt, as you know, from the COSI conference, he was describing his experience with, and he had a similar experience where he had remission of symptoms going into ketosis, and he tried many, many different things, all kinds of different treatments. It'd be a great person to have on the podcast to share about that because it was a really epic journey through, I think, over like 30 or 40 different medical treatments. And eventually they ended up working with Dr. Palmer and Denise Potter, Baszucki, and others that were supporting him doing ketogenic diet. And this led to remission of symptoms when nothing else that they tried over this, multi-year period had worked. So it was a real surprise to them. And I'd put up this YouTube video summarizing my kind of research on it that I've been doing myself for a long time and calling for a trial to happen. And they reached out and funded our pilot study and later also my fellowship so that I could research this more. And so we did a pilot study with 27 people with bipolar disorder who went on a ketogenic diet. And this was a pilot study to kind of pave the way for future randomized controlled trials. And the purpose of pilot studies is to assess, is this safe, is it effective, is it feasible, and what kinds of considerations do we need to have for larger trials. And so the main thing was people said you can't get people with bipolar to do ketosis, and we saw over 91% adherence as measured by daily ketone level throughout the study, which is fantastic, showing that people with mental illness can do this, they enjoy doing this, and it is feasible for them to reach ketosis. And then we looked at how does the daily ketone level correlate to the symptoms. So we've published this as a preprint you can find online. It's in my Twitter, and we'll have the publication coming out this year. And it shows that in the daily measurement of mood symptoms that we took alongside daily measurement of ketone and glucose levels, there was a correlation, a statistically significant correlation between the ketone level and improvements in mood, improvements in energy, and conversely reductions in anxiety and impulsivity. And this is really interesting because you never see blood markers in psychiatry correlating to mental health symptoms in this kind of a way. It was quite a unique study. So I think this is a really interesting indication that this is helping people. And we had a washout period at the end of the trial where we said, please come off the diet, and for 2 weeks we'll measure what happens when you come off the diet. And over a third of the participants said, we will not come off the diet because we're experiencing benefits from doing this. And this was, so we had to try and understand what's happening with these participants. And I presented at Metabolic Health Summit this year some patient videos and experiences, but essentially these participants had physical health benefits. So 95% of people lost weight. The kind of average was about 4.7 kilograms over 8 weeks, which is whilst on all the medications they normally take for like antipsychotics, anticonvulsants that cause weight gain, they were able to lose a substantial amount whilst taking those. And so these participants, we also drew their ketone levels over time, and you can see that the ketone level seems to track with their mental health symptoms over the course of the study, which is quite interesting because it might indicate that the ketone level is somewhat related to what's happening with the change in the symptoms. So this was obviously really exciting, and this prompted us to say, let's try and set up some wider metabolic psychiatry research. So we applied to the UK government as a medical research council, which is what defines kind of like the main, it's funded, many, I think over 20 or 30 Nobel Prize winning science projects. They're the most prestigious funder of science research, probably in Europe. Certainly in the UK. And so we went to them as quite a mainstream kind of organization and said, we want to learn more about the link between metabolism and mental health because it's a huge patient priority. We know that this is, there's a great degree of interaction between metabolism and mental health that we see in population health data. And so along with the Baszuckis, they've co-funded us to set up the first hub for metabolic psychiatry in the UK, which is really exciting because we're now going to do much more clinical trials, data research, genetic research, metabolomics to really kind of like go to the next stage and understand in larger numbers and bigger sample sizes in more detail what is the interaction between metabolism and mental health. So I think it's really great in science when these situations happen where you have a new field of research that patients are highlighting as important, then a funder comes along and funds a unique study, and this leads to a much larger research project. We now have 5 universities in the hub working together to try and understand these mental health and metabolic health links. So it's a very, and this is also paralleled by a center at Harvard for metabolic psychiatry, a center at Stanford for metabolic psychiatry. Many universities now launching metabolic psychiatry centers, and the Baszuckis are really driving a lot of the funding behind this renaissance in research. And I think it's a really cool thing that this came from their own family experience with this condition, because many of the great advancements in kind of medical science come from families taking interest in a condition of someone they care very much about, and kind of raising awareness about it and driving science. So I think it's a really exciting time in psychiatry because of this.
I just can't say enough about the Baszucki family. I mean, what have all of us been complaining about in this space for so long? It's that these trials are not going to get done. There's no industry interest in any of this. Pharma doesn't care about this. The medical industry doesn't care about this. And we need to raise money for this. And this is why, with the work of Dave Feldman and his nonprofit of raising money is amazing. And then all of a sudden, out of nowhere, it seems like the Baszucki family comes in and is funding all of these projects. And it's absolutely incredible the work that they are doing. And these questions are getting answered all over the place. It's wonderful, all of their work. And I understand that for, the pilot study, you needed to have a washout period, but I would be the same, man. If you told me to go off this diet, I'd be like, over my dead body, absolutely not. I'm not going off this.
I mean, that's what I feel like. There's such a cost to me for going off the diet, and it's really happens quite quickly. And it's just not worth it. I think they kind of like, it's hard to describe, but I'm like a functioning person. I'm an academic. I'm a father, but I'm not like that if I'm not in ketosis, and I can't function anywhere near like even a normal, just a kind of like just at a normal level to get through the day. And so for me, it's staying in ketosis all the time. It doesn't, people say like, oh, do you need discipline and do you need, but it's almost like if you are having struggle, if you're struggling to get oxygen and you're given an oxygen mask, you'll be kind of highly adherent to this oxygen mask because it's really helping you to live your life. And that's obviously an extreme example, but in some ways ketosis is a bit like that, where it gives you so much if you have this kind of metabolic dysfunction that it's not worth coming off it for many people. And other people cycle on and off and they have success with that. For me personally, I have to stay on it all the time.
Yeah, that's a really great analogy. I actually really love that. And you had the opportunity to present your work at different conferences, obviously going around and presenting them at low carbohydrate conferences. That's a bit like putting a PowerPoint together, saying how great Manchester City is, presenting to a bunch of Manchester City fans. We're going to love that, and we're going to cheer you on and say that's all great. And again, COSI was that experience for me. Everybody was kind of in there for that reason. And so selectively, all of us are going to improve this. But you've also had the opportunity to present this data at other conferences that were not necessarily low carbohydrate conferences, more kind of mainstream medical conferences. What experience has that been like for you, and how has this been received? Sometimes I lose track of what this looks like to the outside, space of this world. How is it being received?
Yeah, I really appreciate you bringing that up, because that's something I'm very passionate about, is bringing this into spaces in psychiatry that wouldn't normally be aware of kind of metabolic health in this way. And so it's been really amazing. We went to ISBD, which is the biggest bipolar conference in the world. It's the largest, most prestigious bipolar conference, and they gave us a symposia, which is like one of the main events of that conference. And I presented with Shabani Sethi and Georgia Eads, results from her trial at Stanford, R1 at Edinburgh, and also Georgia Eads' paper from the Dr. Tanan study in France. And it was really remarkable how open and interested people were to this. I think it's just partly because in psychiatry, there's been so few major developments in the past kind of 50 years in terms of treatments that are widely available. There's maybe, there's been tens of millions spent in research, but there's really hardly any new treatments that are accessible widely to patients that are kind of more effective. And it's kind of crazy that that's the case. There's so many other fields of medicine where we've made a lot of progress, and psychiatry is really kind of stalled in comparison in many ways. So I think people are excited to hear about something that's new, and this kind of interface between physical and mental health is something everyone is interested in at the moment. So it really plugged into kind of this need for new ideas and new ways of thinking about mental illness and the physical mental health connection. And so it was really well received. And a lot of the researchers at that meeting are now launching their own keto studies, their own keto trials. Even people that were kind of initially quite skeptical about this have now really gone into this field and seen that we need to understand more about this, which is really exciting. And we're also going to the Royal College of Psychiatrists International Congress this UK. It can't get any more, mainstream in terms of psychiatry than that, because these are the people who decide on psychiatric care in the UK. And none of them are kind of specifically educated, to my knowledge. Maybe some of them are, but in ketosis or these kind of concepts. So it's really gratifying to go to these kind of conferences. And we had a symposia accepted at that conference, which I think is really exciting. And continually we're getting more and more interest in this field from kind of more mainstream scientific conferences and psychiatric conferences. And that's where I want to go, is into these more difficult areas where to raise awareness about this, both as a patient and as a researcher.
Yeah, I love that. I'm sure they have the same kind of progression of questions that all of us have. Like when you first learn about this stuff, I'm sure they're
Yeah.
concerned with eating that much fat and eating a lot of animal products, or what happens to heart and cholesterol and all those things. Have you noticed that they have those questions that we all did in the beginning?
Yes, definitely. It's and they often come up. It was brilliant when we were at ISBD, the cholesterol question came up, and thankfully Brett Sher was in the audience, and he just stood up, and it was like watching someone who's prepared their whole life to play baseball just go up and knock it out of the park. It's like he was born to answer this question. So I think it's been really, so those questions definitely come up, but then but thankfully we have so much kind of knowledge about this through learning about it through epilepsy and other fields that we have some good answers. And obviously the work of David Feldman, Nick Norris, Adrian Sotomoto, people like this are really kind of helping to address this now in a kind of a real rigorous scientific way. So yeah, those questions come up, but I think on the whole people are just really interested that there's a new perspective, that this is coming from patients. I documented 174 patient reports or 164 patient reports in the British Journal of Psychiatry Open. It's really, and I've just done a survey that's over 100 people with bipolar disorder talking about their experience. So I think they're just interested and they want to understand what this is and can it be useful. And my impression in general of psychiatrists is that they're people who really want to help their patients, and they want better tools and more effective tools, and they're really passionate about learning about anything new that can help their patients, and that's a really great thing for patients to have a kind of field that's like that.